Welcome to Watch Your Mouth, the podcast of the Ministry of Health and Wellness's Oral Health Unit. I'm your host, Dr. Chanel Dempster-Peart, and today we have the honor of speaking with Dr. Winston Grey, a retired regional dental surgeon and a stalwart oral health advocate in the public health sector. Dr. Grey brings decades of experience from the front lines of oral health care, and today he's here to share his insights on oral health in Jamaica. Dentistry is in his DNA. Dr. Winston Grey was inspired by his dad, who was also a dentist, and has gone on to influence numerous individuals to pursue dentistry, including his daughter. He's a past chairman of the Jamaica Dental Council, founding president of the Jamaica Association of Public Dental Surgeons, former professor and lecturer and fellow of the International College of Dentistry. Dr. Grey, thanks for joining us. Dr. Grey, let's start off by talking a little bit about what your perspective is on the current state of oral health in Jamaica and how it has evolved in your career.
I think that the current state is one in which we are trying to utilize methods that can reach a larger portion of the population rather than trying to focus on any one service. So we have kind of adapted this kind of more preventive aspect where I think in the long run will kind of reduce the cost of trying to of betterment in terms of the whole outcomes. However, we still have this large population of diseased, if we may call them that, diseased persons that need to have treatment. And I don't think that we are providing enough care in respect to that. However, because of the cost of these services, I think it's still better utilized that we go along the path of prevention so that we have, in the long run, the load will take its time and decrease over a period of time.
Okay, so prevention, you believe, is the way we should be going,
yes,
and you're happy to see that.
Yes, I am.
What are some of the most common challenges that you encountered in public oral health?
I think it was the overwhelming amount of persons that decided that dentistry was all about doing extractions. Mm-hmm. And that was one of the sad things that I had to experience. However, it was needed. However, the point, it speaks to the severity of the oral disease in terms of caries that we were experiencing. And to some degree, we have kind of lessened that load, but it's still very high. I mean, when we look at a lot of the health fairs that we put on, dentistry is always oversubscribed, and it's always about extractions. So we still have a big problem that needs to be solved, and we just have to keep pushing ahead. Hopefully it will decrease sufficiently that we can begin to deliver more quality care in terms of the other services.
Okay, so did those challenges affect your day-to-day delivery of care in the health centers?
I would say yes, because you have this situation where you have a limited amount of time and equipment to provide care to a specific number of people, and then you have a situation where people are coming and it's pretty much oversubscribed. You cannot provide all of the service that is needed in that particular setting. Mm-hmm. And so somewhat you feel frustrated because they're trying, and then there are so many people that are coming and not getting through, mm-hmm. and are left to suffer in pain. That's basically it, and that's not a good thing for any medical person.
Thankfully, as you said, we are moving towards prevention. But over the years, are there any trends that you observed in the field of dentistry that have reshaped how we have approached oral health care delivery?
Well, the trends, the trends are always kind of linked to the resources that we have available to provide the care. What has happened to dentistry for a long time is that um, we have never really gotten what we would think is a fair resourcement of of materials and equipment to be able to provide a service that is really, really tangible. So what has happened to us is that we have had to kind of reconstruct the resources into a more preventive type of care. And we still have people languishing and needing the more tangible things like caries reduction, periodontal disease reduction, and we're still not able to provide those things because we don't have enough hand pieces over the years, we don't have enough x-rays and all of these things. A lot of more of those things are coming on stream.
Yes.
However, it's still far from being adequate.
Fortunately, as you said, we are moving in the right direction, though, and getting a lot more of those things. Could you describe your most memorable or impactful experience that you had as a dental surgeon in the field?
I would think that it would be being part of the whole training of new dental surgeons, because when I look at what is happening right now, most of the ones that are there serving in the public service are a lot of the person that I trained. But so I think that out of one, me being me, I was able to generate a good amount of persons that could help to the whole thing of taking over. And I think what was very important about it was that we had to begin training Jamaicans in Jamaica. We couldn't continue sending them away because you send them away to be trained, they don't want to come back.
Yeah.
So at least we know that when we train them here, they want to go away, But at least we have more of them staying here and trying to provide some degree of service for the people of Jamaica.
That's an excellent point, and thank you so much for your service in doing that. What new technologies, though, are you looking forward to? New treatment modalities? Anything is exciting you about dentistry, and how do you see them influencing the future of dental care in Jamaica?
Well, I mean, I think the most exciting thing really about dentistry right now is the whole issue of computerization, CAD/CAM development of a lot of the prosthesis that we can provide to rehabilitate people, the whole issue of the implant sector coming on stream and being able to be assisted with a lot of the computerizations that help to make that era easier.
Yeah.
But I think that is pretty much where everybody's going, but it's kind of like on the high end, and it doesn't really apply a lot in terms of a public health delivery in Jamaica at this moment because we're not even anywhere near that level. I mean, we're still kind of battling with us trying to do the basics, which is to reduce the amount of caries, fix which teeth we can fix, and prevention. So we haven't reached a stage where we can really utilize that in a lot. I mean, now we have started this issue of providing some removable dentures.
Yes.
In this, we call it the Smiles, the
Second Chance
Smiles
yeah.
program. However, again, this is a drop in the bucket because this should have been done years ago because we've been taking our teeth for like 100 years and we're just about the third year or second year into trying to help them rehabilitate the people by putting back the ones that we took out. So we're still just a small drop in the whole bucket of trying to, rehabilitate persons in Jamaica.
All right, Doc, in your view, what role do government policies and public health programs play in driving improvements in oral health? And what areas do you still think we need to develop?
Well, policy is very important because, in public health, there's always this aim to try to first remedy the most severe health conditions with the simplest and, if I may say so, probably the cheapest or what is the least expensive route
Cost effective.
or let's call it cost effective, yeah, way of doing it. So we're still having to battle with that, and we can't decide so we want to talk about these high-end things and be spending all this money. So you're going to be spending millions of dollars to bring in all this CAD CAM stuff, where the million of dollars could be helping a lot more people. So we still are, I'm saying, not at the stage where we can really be looking at a lot of these high-end things, because we're still at the rudimentary stages where we're just trying to solve the basic problems. And there's no other way to do it. You just have to try to deliver as much as you can to the neediest. That's what it's all about.
Do you think there are any cultural or societal factors in Jamaica that uniquely influence our oral health outcomes, whether it be positive or negative?
Well, we have developed a culture that has kind of thrived on the service that we've been able to provide for the people. So, in the time of my father, even before, it was always about trying to do extractions. People would not come to the dentist unless they needed an extraction. If they had pain, they thought the answer was an extraction. So we have developed this culture of the remedy the remedy for toothaches or for any problems with teeth is to extract them. So we've been fighting that culture for a long time, and you can see where there's been a kind of change where, especially in the private care, where you see people might spend a little more time trying to save to doing more root canals and things like that. But in essence, we have this culture of wanting to just get rid of teeth. I mean, a lot of people in Jamaica are less concerned about looks, even though we have a sector where we have a big tourism sector where aesthetics is supposed to be a big important thing. But aside from that aspect of the society, people in Jamaica really don't care much about teeth, as far as I can see. I mean, it's kind of getting better, but we need to kind of push that a little bit more, where people take a greater pride in teeth.
Yeah.
I mean, you want to have teeth. I mean, your self-esteem and everything is all about teeth. So we need to be pushing a lot more along that line.
Okay. Well, Doc, thanks for your time. But every guest here on Watch Your Mouth is asked to give us one parting word, like a last lick, as we say in Jamaica. So what's yours?
I think it would be underutilized because,
Wow.
what has happened is that, having spent my whole career in public service dentistry, you don't feel as if the whole aspect of your talent and ability and skill have been utilized to help the people. Because you're there, so yes, you will work and try to work hard, but it's just in this one little area of excellence, which is like extractions. Your talent has not really been utilized, despite the people paying you so much money, and you can't get to deliver the other aspects of dentistry that we think is important.
Well, on that note, we're going to wrap this episode of Watch Your Mouth. A heartfelt thank you to you, Dr. Winston Grey, for sharing your wealth of knowledge and experience and being very candid and insightful on the state of oral health in Jamaica, the emerging trends, and the critical role that public health has in shaping our future. Your stories and expertise have reminded us that every smile matters, every tooth matters, and that continuous improvement in dental care is vital for our communities. So until next time, watch your mouth.